When you look at the Commonwealth, it's 54 nations around the globe, and they have very different needs. And if you look at the way that COVID-19 is impacting them, it's very different. So Canada, for instance, has about 70,000 confirmed cases, while the whole continent of Africa has about the same number. So how does the Commonwealth go about, responding to the pandemic on a global nature, because you have 54 countries around the globe with various different needs?
Yeah. Well, I think one of the most important things is that we do have those 54 countries. And as you know, we have rich ones, we have poor ones, we have big ones, we have small ones, and we have everything in between. And because this pandemic is something that none of us have seen before, and there was a real ignorance as to how we should deal with it, it's meant that we've had different iterations, that some of our countries who have experienced it first and maybe have not known quite how to respond effectively, we've learnt from what they did and what they failed to do. And in sharing all of that knowledge, all of that understanding, we have been better able to support those who are in the second wave to do earlier the sort of things that will really make the difference. So, for example, if you look at what India has done, India has 1.3 billion people. Yet, if you look at the impact of the COVID pandemic, it has been very much contained because Prime Minister Modi immediately, that the threat appeared, locked the country down, put in the measures the World Health Organization suggested. And if you look at the numbers, they are markedly lower than almost any other country. So it is the fact that we've learnt from each other and can help each other to know what to do and to know what not to do. And that knowing what not to do, I'm afraid, is as important as knowing what to do. So if you look at India itself, it has only got 74,000 confirmed cases. And out of those cases, you've got 2,400 deaths. Now, every single person who dies is treasured, is loved, is valued. But the ability to contain those numbers, vitally important. So what we're finding is, because we are pooling the information across the 54, working together collaboratively in partnership, we're able to better protect our member countries, particularly those who are least able. So if you look at Africa, it has less ability in terms of financial positioning, but they've come up with some brilliant ideas which innovatively have made the difference.
Well, that's what I wanted to ask you is you brought about this, is that there are different circumstances among the 54 countries, and there are some rich ones, there are some poor ones. So how is the knowledge being transmitted, and what steps and in what ways is the Commonwealth actively helping, one another out?
Well, immediately this happened and we had to go in lockdown. I came home, but we decided that we would put everything up online and we would create a virtual Corona resource center. That resource center was able to pool all the information we already had. So, for example, we had in 2018 created an innovation hub. In that innovation hub, we had the data in relation to all the sustainable development goals. So we had an understanding from the data that we'd got from the World Bank, from the IMF, from the UN and other in multilateral organizations, together with the information that we had ourselves accrued over the years. So we really understood the position of each of our countries. What we then did is we created a Commonwealth tracker, which we embedded in the WHO tracker. So we extracted all the specific information about each of our countries. So we were able not only to look at the information about what was happening in the pandemic, but what was the universal health care coverage like? How many women, how many children, what were the unemployed, who were the left behind, who were the vulnerable? So through this analytical approach, we were able to give a more holistic analysis to assist our member states to know how they could prepare better, because we know prevention was going to be much needed, particularly for those countries who did not have the health infrastructure or estate to deal with masses of interventions coming in a hospital setting. So we were looking what works, what doesn't work, and we were sharing that information. So if you go onto our Commonwealth website and look at the coronavirus center, you'll see a plethora of information.
I want to come back to some of the challenges that some of the countries are facing specifically, but I also want to touch on the challenges of trying to get that information out, to try and getting that support out, because it is such a disparate number of countries around the world. So what specific challenges have you faced in addressing this, and how have you overcome them?
Well, one of the terrible things that we're facing, and it's an intersection with the coronavirus pandemic, is the climate crisis. Because in the Pacific, we have just seen the whole area hit by the storms that's been caused by Cyclone Harold. So you have cut off from the rest of the community. Things aren't flying in. Yet you have to have social distancing at a time when you're dealing with a crisis. So that's one of the issues. How do you keep that connectivity going? But we know that we already have in Africa locusts, drought. We just started the flooding that you've seen in Kenya and East Africa. 100 people died in Kenya just last week. And we're at the beginning of the monsoon season and then the hurricane season in the Caribbean. So that intersection between climate crisis and pandemic is critical, together with the potential economic tsunami that will come as a result of us taking proper steps to keep people alive. That's going to have a terrible impact on us economically. So we had to go digital. And then you've got another problem, because there is a digital divide within our Commonwealth. Some of our members are still on 2G, some are on 3G, some are on 4G, some are about to migrate to 5G. So keeping a platform which will enable us to communicate again throughout all of those has also been challenging. But what we have done in the Secretariat is to maintain that platform so that we can communicate. But we've also not just relied on the Secretariat. We have almost 90 organizations who have been up and running for the last 70 years, who are Commonwealth civil society organizations. So we've got the Commonwealth Medical Association, we've got Commonwealth nurses, Commonwealth pharmacists, we've got people like Rotary in all of those countries. And so what we've been able to do is brigade all of those accredited organizations to work with us. So, for example, our Commonwealth Medical Association have put together an emergency committee, and they're sharing all the knowledge they have. They are putting up educational platforms, teaching the doctors and the nurses who've never seen this before. How do I respond? How do I respond well? How do I recognize COVID? The nurses are setting up stations where they can teach other nurses how to do it. And the pharmacists have been brilliant. Many of our countries have not had access to delivery of sanitizers. So what our Commonwealth pharmacists are doing is they are coming up with the ingredients, and they're working with their local pharmacists to say, what have you got on the ground from which we will help you by coming up with a formulae to create your own local sanitizer. And we've got brilliant work happening in the Commonwealth. So, for example, in Ghana, they have identified the genome of COVID. A number of the Nigerian entities are coming up with smart solutions. In India, they have identified a test that you can take really cheap, really easily in order to maximize the opportunity to identify it. But they're creating apps. One of our members have created an app so you can download it, and you can make an assessment of yourself as to whether you have the sort of symptoms which may indicate that you have COVID, and then how you can intervene early.
I'd like to follow up on that because, like you mentioned, you're coming on this with some climate change issues, the locusts, the cyclones, and so forth. The challenges of getting materials to and from locations in this age of physical distancing. And as I have spoken to many health professionals, they say the key is testing, testing, testing. And you spoke about some of the innovative tests that are coming up from the Commonwealth countries. So how do you get materials, testing, PPE, the personal protective equipment, where there is none from locations that there are none, and maintain that continuity of connectivity given the disparate nature of some of the infrastructure on the communication side?
Well, what we are doing is by using the Coronavirus Center and all of our contacts, the multiplicity of networks within networks, that we are pushing the information through those different ventricles to make sure that the information is getting to where it needs. And we are also trying to take advantage of the indigenous knowledge. Many of us have migrated to the smart stuff, but the stuff that our grannies used to do actually works just as well if you identify what they used to do, why they used to do it, and how we can replicate it. So we are doing a very much what works sort of network. And if you think about India, India is probably the biggest supplier of medical equipment and medical services and medicines everywhere in the world. India is doing a great job reaching out to a number of our smaller member states. So they're supplying medical supplies to places like Bangladesh, Sri Lanka, Maldives, but small islands like Seychelles in Africa. And this South-South cooperation, this cooperation which is right the way across the north, the global north and global south, is really making a difference. And I think one of the good things about our Commonwealth is we come from 5 different regions. So we have all races, all cultures, all economic positions. So when we're trying to craft something, we are able to draw on those 54 countries who are able to give us the specificity of their day-to-day reality to say, well, what about me? I'm Nauru. I only have 11,000 people. I can't make anything. I don't manufacture PPE. I don't know what to do. And yet we look at what's happening in Fiji and Samoa, and they are using the traditional bark that they have for material to turn that into really effective face masks. So we are looking at some of the indigenous skills and crafts and equipment that's there locally and saying, how can I translate that into something I can use? And we're also repurposing a number of the manufacturing. So, for example, Nigeria didn't have enough manufacture for PPE. And so they have repurposed a lot of the other manufacturing to convert it into an ability to make PPE and to share. And this working out how innovatively we can move forward and looking at what joins us has really been successful. And the fact that we've got geniuses all over the Commonwealth who are coming up with ideas to say, this is what I made earlier, and we're pooling it. So if we understand that, let's say you've really screwed up, it's a total mess, you've spent all this money and it hasn't worked. We're not saying, poor you. We're saying, great, tell us what you did so that none of us have to do it. We will also share our successes and our failures with you. So we are saying to people, whatever you've done, whatever the experience is, please tell us, because everybody is testing this and experimenting. Nobody's seen it before. All of us are going to make mistakes. All of us are trying hard. So why don't we just pool everything that works, everything that doesn't work? Because what we're saying in the Commonwealth is if one of us spends a penny, a dollar, a rupee, then let's hope that no other member state has to spend the same penny, dollar, rupee. Let's spend a different pound, a different penny, a different rupee. And together, and it's this collaboration that I think has been so amazing. It's the collaboration which is going to get us out of jail. It's this combined commitment. And I've loved the fact that every single Commonwealth country has come forward and said, how can I help? You can have what I have. Nobody's saying this is my intellectual property and you can't have it. And we're doing it with the lawyers because what do we know? Our small businesses are going to take a real hit. The SMEs and those working in the informal economy are really going to suffer. So how are we going to make that good? How are we going to get people back up? How are we going to look after the young people and the unemployed who are qualified but may not now get a job? We've got to look at what's happening to women, because what's been really heartbreaking is because so many people are locked down at home, domestic violence is going through the roof. It's gone up threefold. We've got probably, in some countries, it's between a 30% increase to a 300% increase. We're having more deaths, almost a doubling of deaths happening because people are locked at home with the perpetrator. Our kids are being materially affected. Still, girls do more work at home. So you're finding that if the girls are at home from school, they're the ones doing the housework and the boys are the ones sitting on the computers. So how are we going to make sure that our girls are getting as much education as our boys and that this is a fair distribution? All these, unfortunately, are common problems, and we've got to deal with all of it if we're going to get out of this pandemic safely.
Patricia Scotland is the Secretary General of the Commonwealth of Nations. Thank you very much for joining us on Skype.
Thank you very much indeed.